Hi, I'm Jeanne Pinder of clearhealthcosts.com here on behalf of Health Innovation TV. We're at the Health Datapalooza in Washington, D.C. with Alex Fair, the co-founder of MedStarter, and Pat Salber, who's the CEO of Health Tech Hatch.
You got it.
Here to talk about healthcare innovation. So I'd like to hear from the two of you how you guys met. Pat, ladies first.
Okay, it's actually a great story because we're competitors, but we have a mutual friend, Greg Masters, who's now a part of Health Innovation TV with both of us. And he talked to Alex and mentioned that I lived in the Bay Area and Health 2.0 was going to be in San Francisco that year, and suggested to Alex that he should call me up, his competitor, and do a party together. So Alex, take it from there.
You know, I told Greg he was crazy, that, we shouldn't be doing that. And then I grew up a little bit and, called Pat one day. I think I was driving on the BQE or someplace like that. There's a lot of traffic. So I was in an adversive situation anyway. Nonetheless, Pat was very gracious and kind, and we became friendly. And, when you're competing with great people with a lot of class, you learn to learn from each other. And that's really what's happened with Dr. Salber and I. And I come from the patient perspective. She comes from the physician perspective. And I think we both add a lot to this conversation. I really love what Health Tech Hatch was doing. And we really wanted to have a really big party in San Francisco to, we called it the healthcare revolution, right? So I run events in New York all the time. It's not really, I'm more of a left coast kind of person, or right coast, East Coast, rather than West Coast. But you're the left coast, right? We're the right coast. Does that make you the wrong coast?
No, it makes us the right coast. The right coast is the left coast.
So, but no, Greg is also on the left coast, and so it was a great way to sort of start, instead of having an east-west or patient-provider, because we're all about collaboration. So I think it was a beautiful event, a lot of fun.
That sounds great. I'm sorry I missed it. So Pat, would you tell me the most exciting thing that you're working on right now?
Sure. There's actually two exciting things, if I can do that. The first is that and this was launched yesterday here at Health Datapalooza, Health Tech Hatch will be the co-design platform for a brand new challenge announced by Farzad Mostashari that will for the first time, engage patients from the beginning of the challenge all the way, Alex is helping me out here, from the beginning of the challenge all the way to the end of the challenge. It's called the Blue Button Patient Co-Design Challenge. And the point of the challenge is to use data that comes through the Blue Button to encourage developers to design apps that make that information useful for patients. And what I thought was so creative about what they've done is they said, we shouldn't presume we know what patients want to do with that data. Why don't we, what an idea, ask them. So we're crowdsourcing the ideas. And can I tell people to go there?
Absolutely.
So we want everybody to go to ideas.healthtechhatch.com and post your ideas between today and Friday, which is the 11th. And then the best of those ideas will be chosen to be the ideas that the designers design the apps and tools to. And then we've got a community of patients that will come to our site and will co-design iteratively with the designers. So what comes out at the end will be stuff that patients had input into and said, that's the way I want to see this used. And then the crowning thing, which is really nice, is that we'll be crowd voting the winners at the end. So all the way from ideas through design to who wins the challenge engages patients, which we think is really, really exciting.
Sounds like fun. Alex, what are you working on that's really exciting?
Well, I can show you. But we also have started a challenge, and we have a ton of amazing projects on MedStarter. But one of the things we noticed when we started doing crowdfunding is that partners come forward and they get involved in the projects. So you might have a GE or a Pfizer or Bausch and Lomb come on and get involved in the site or in the project on the site. So we figured if we went directly to the partners first and said, hey, wouldn't you love to drive innovation? Instead of just waiting for something to be created, you could actually foster the development of it. So one of the first companies to get involved is CR Wireless. We were running a challenge for them. And now, right now, at Health Datapalooza, we just announced phase 2 with Health 2.0. The Health 2.0 ran phase 1. We're running phase 2 on MedStarter. And the idea is that people who have survived cancer, and then 14 million of them around the country, don't have a really great way to coordinate their care and to stay connected with their care plan and their physician. A lot of people sort of fall off that map, and it doesn't really help them get better and stay better. So Health 2.0 ran this really great campaign. We had over 30 applicants, and I understand it was one of their better campaigns. We helped out, and Two Health Guru and Health Innovation TV also helped pass the message along, and we got the message out to over a million people. And so we got some great applications, and now you can actually find and fund the best ideas. So there's 3 ideas that have all gotten $5,000 from our government, from the ONC, the Office of the National Coordinator, and the National Cancer Institute. And you can go online right now. You can see this one was created by a physician, Michelle Longmire, in San Francisco. And she recorded a little video, and you can actually get behind it. You can acquire the app. You can support the development of it right here. And you can see that she's already raised $5,085. So now $5,000 that came from the government, but $85 came from other people who came and found and funded the idea. And you can actually look at all 3 of them in a single showcase. You can see a little more information about the Crowds Care contest, things like that. So you can go to www.medstarter.com/crowdscare and find and fund the cancer innovations that you care about.
That's terrific. Thank you. Would you care to tell us, Pat, what's the most interesting thing that you've learned here at the Datapalooza?
Besides the announcement of the challenge?
Yes.
Well, I think for me what's really been exciting is to see how far and how fast things have happened in this arena. We weren't talking big data 5 years ago, and I don't think it would have even crossed my mind when I was in practice that big data meant anything. We were still charting on paper. And so I think the rapidity of the change, the magnitude of the change, and the hugeness of the promise of what we're going to be able to do once we have all that data, and not just financial and utilization data, but when I think about the power of complex clinical data and what it'll mean in terms of me as a physician, being able to take care of patients based on having a whole wealth of information that was just plain not there in the past. It's very exciting.
That's great. Alex, same question for you.
Well, I'm very excited about the idea that you'll have releasing all the CMS data about Medicare payment information and charges. Jeanne actually runs a company called Clear Health Costs, which is an amazing solution to figure out actually how much healthcare costs. This is a topic that's near and dear to me because the reason I even started MedStarter was because I had created a different price transparency solution called Fair Care MD, which it's worked. It's about 500,000 people have been to it and done some good things. But really, one of the real barriers is finding out how much things actually cost. So that's why I've always loved what Jeanne's doing with Clear Health Costs. So Fair Care MD, you can go and you can search for a provider and see how much you actually would pay for with that provider. But with Jeanne's project, it's a real crowdsourcing solution for it. I'll pull it up here in a second, but do you want to tell people about it, and I'll show you.
Oh, thanks.
What's the URL?
So it's clearhealthcosts.com. And we have several sources of information. I'm a journalist. I was at the New York Times for almost 25 years before I volunteered for a buyout. Won $54,000 in grant money to bring transparency to the healthcare marketplace using tools like journalism, data sourcing and curation of databases, data visualization, and crowdsourcing. We're collecting prices of common procedures in various marketplaces. And you can see the wide range. For example, an MRI of the lower back will tell you the range.
Which you can get on Fair Care MD for $399, thank you.
And we'll tell you what's the Medicare price, which is the closest thing to a fixed or benchmark price in this marketplace. Also, other providers and where to contact them. so that you have shoppable information about common procedures in the New York area and other cities across this great wide land of ours. Yay, transparency.
Absolutely. That was the most exciting thing.
Yay, transparency.
So do you have any closing words for the audience?
Well, actually, I'd like to say a few words about our view of crowdfunding, if it's okay, because we're taking a little bit different tact from a MedStarter. We've had our own crowdfunding platform. We went live October 8th of last year. And we've learned a lot of lessons, and Alex and I talk about this, that there were, it was kind of unknown how this was going to play out. We were pretty early. And what we found is that it's really very difficult if you're not crowdfunding somebody who has a cool gizmo or gadget, somebody who has a Misfit Shine or, something like that. And so the amounts of money were really pretty small, and it's pretty complex to run a crowdfunding site from the back end. I think you'd agree with that. Alex doesn't agree. For us, it was pretty. It was pretty complex.
We have completely different views on this, but go.
And so what we make, and this is, I think, a good thing for us to talk about. So we've decided to crowdfunding platform, but rather to partner with Indiegogo, which is a general crowdfunding platform with an international reach. So we're now an Indiegogo partner, and when people come to us to crowdfund, they'll get their pictures of their campaign on our site, but the whole back end will be Indiegogo. So we're really saying this will be an opportunity for people to crowdfund Indiegogo Plus. You'll get Indiegogo Plus, you'll get kind of the stamp of approval, the vetting by Health Tech Hatch, and we have a range of services we can offer people to help get their crowdfunding platform up.
That's great. Congratulations.
Thank you.
Alex.
So I came at crowdfunding from a different tack. Health 2.0 is an amazing ecosystem that supports healthcare innovators. So they bring patients and doctors and payers and everybody together. So I've been running this thing called Health 2.0 in New York since 2010, and it's about 3,000 people like us, innovators in healthcare. So it's a whole ecosystem. So when we went to go start a crowdfunding site, we actually already had a lot of the supporters we needed, not just from the physician side, not just the patients, but also the hospitals and the big partners. And it really helped things come along much faster. So our project's actually raising $10,000 or so on average, and raising a lot more money off-site. So basically the investors would be looking at MedStarter to see ideas that had gotten traction in the marketplace, and then they'd go on to raise millions of dollars elsewhere. We also took a very proactive approach to our clients. So our clients, they're doctors and patients, and so they went to med school or grad school. They didn't go to business school. They don't know how to write like Jeanne.
We went to med school and business school.
Increasingly,
that's what they're doing.
Yeah, but they still remember that they were doctors first. So we had MBAs and people who are great marketers, guys like Steve Green and Greg Masters get involved with our projects, amazing mentors, and they make these things work, right? So. And then they go on to bigger things. So we think of it as like it's a way to do seed funding. And some companies like Fred Trotter's, they don't actually need to go out to get funding afterward. They raise $45,000 on MedStarter, and then they've got 24 really great customers afterward. Companies like Vitals and the Advisory Board and all these amazing companies that are using their data set, even HealthTap. Although, So we've actually seen some really amazing stuff happen. So we're sticking with crowdfunding. We added on challenges to automate the partner relationship. And we also actually have a partnership with Indiegogo coming up now too, because after they've raised a good amount of funding on MedStarter, or maybe sometimes concurrently, we like to think that there's a bigger audience out there. We have an audience of physicians and patients and investors who are really focused on healthcare. But a lot of things, once they get to a certain level, once they have a good app, so MyFitnessPal might have started with a really good app that was designed by nutritionists, but eventually they get out to the marketplace and they get out to millions of people directly. So I think there's a role for both. So
the last word. It's really, really fun to me to have Alex as my friend and competitor.
Thank you. It's been a great ride. Thank you.
And thank you so much for joining us, Pat and Alex.
Thank you.